My name is Stephanie Plummer, and I'm a physiatrist at Carolina Neurosurgery and Spine Associates. RFA stands for Radiofrequency Ablation, and it's a procedure where we use a radiofrequency current, and that actually creates a thermal energy that we can use to block nerve signals that come from a painful joint. We can perform a radiofrequency ablation either in one of our outpatient offices, or we have access to a surgery center, an ambulatory surgery center, where we can perform those procedures as well. An ambulatory surgery center is a facility that resembles a surgical facility in a hospital, but in the outpatient setting, where we can perform procedures that are a little bit more advanced or require more attention than in the office setting. In the surgery center, as compared with an office setting, we can often bring patients who have more mobility concerns. We have more resources there to be able to position patients onto procedure tables. We also have access to a higher level of monitoring so that if we need to provide additional medications for sedation or for comfort for the patient, we have the resources to do so. The benefits of radiofrequency ablation allow us to reduce pain that a patient is experiencing from painful joints or arthritic joints in the spine. It allows us to block that painful signal that's being transmitted by the nerve back to the brain. The radiofrequency ablation procedure is performed using a specialized needle tip. We use our radiofrequency current to create thermal energy at the tip of the needle that breaks down and cauterizes the nerve so that it can't transmit signals anymore. It's performed in the same way as a lot of other procedures are performed. For the patient, it's usually a very comfortable procedure. We can provide appropriate numbing of the area so that they don't have a lot of discomfort, and it usually goes pretty quickly once we get started. The risks of radiofrequency ablation are the same as any other procedure that we would be performing using a needle. Those risks always include bleeding complications, potential for infection, injury to tissues around the area where we're working. We expect all of those risks to be very minimal, and we don't ever expect that those things are going to happen. There are additional risks with radiofrequency ablation for patients who have certain types of metal implants, pacemakers, or other stimulators that we need to take into account before we begin the procedure. A good candidate for a radiofrequency ablation procedure is a patient who's having pain that comes from arthritis in the joints of the spine. These are patients who have mostly neck pain or back pain without a lot of pain that radiates from a pinched nerve in either the neck or the lower back. In terms of disqualifiers for the radiofrequency ablation procedure, there are some patients who have certain types of implants, such as pacemakers or stimulators, or extensive surgical hardware that may be in place that might prevent us from doing the procedure safely.